Senior Medicare Patrol is a federal program of the Administration on Aging and the Administration for Community Living, and in Louisiana it is sponsored by EQ Health Solutions. Our mission is to teach Medicare beneficiaries, their families, and their caregivers to prevent, detect, and report healthcare fraud.
Medicaid fraud has constituted 10% of the funds that are given for Medicaid. According to the national survey, there's that much fraud. Louisiana receives $6.6 billion a year in the Medicaid program, and that means $660 million is defrauded from our program. The Senior Medicare Patrol works very well with the Attorney General's office. Our staff who work every day with them, it's absolutely crucial for us to network into each other's sources of information and to share information. That's called the team approach. As Attorney General, I'm a big team person. It's about how well we work together, and it's unbelievable how much more good we can do if we share our sources of information. So that has been a very valuable resource for them to be able to call our office and talk to our people who are in control of the Medicaid fraud unit and to keep that relationship on the front burner.
Senior Medicare Patrol in this state are vital partners of Health and Human Services in our mission to combat healthcare fraud, Medicare fraud, Medicaid fraud. We investigate anything that comes through the door that a complaint has to do with, and it goes all the way from a hospital administrator to a physician to a nurse practitioner down to a business owner. Senior Medicare Patrol, there are boots on the ground. They interact with senior citizens every day. Our Medicare beneficiaries are out there getting information from Senior Medicare Patrol regarding current scams, ways to protect your Medicare card, the red, white, and blue card. Vitally important to protect that card just like it were a credit card, because identity theft in seniors is very high, and a lot of our Medicare beneficiaries, which are vulnerable victims, they lose benefits because people have billed for those benefits fictitiously. Additionally, when the Senior Medicare Patrol finds a Medicare scam that's ongoing and hot, we can take a proactive stance and get going on it immediately.
My whole professional career has been a healthcare provider. At the point I moved into an administrative position and ultimately worked for the Department of Health and Hospitals, retiring as the Medicaid Deputy Director. In that period of time with the Department of Health and Hospitals, I actually was involved in Medicaid fraud detection. I investigated Medicaid providers and would make referrals to the Medicaid fraud unit if it were warranted. I saw the ad in the Morning Advocate about volunteers were needed with the Senior Medicare Patrol. And working investigations was always intriguing for me, and the retirement gave me an opportunity to have some free time and an opportunity to give back. So I thought the Senior Medicare Patrol was an easy fit for me, and it has been found to be that. When I work in the community, I talk to seniors about protecting their Medicare card, detecting, so when you get that Medicare summary notice and it says, this is not a bill, do not tear it up just because it said it's not a bill. Look it over, review it, make sure what's there, you got it, you received that service from the provider that's identified as delivering the service, it was on the date that you received the service, and if there's any discrepancy in that summary notice, pick up the phone, call the Senior Medicare Patrol, because it's your responsibility to report that. You could be part of a big scam, you could be part of just an abusive practice with a medical provider, or it could be a billing error, it could be very innocent. But without your picking up the phone and reporting it to the Senior Medicare Patrol, it would never be detected.
If you suspect something, please get in touch with Senior Medicare Patrol so we can potentially prosecute the wrongdoers.